Next one is the pelvis, and we'll mention a little bit about the hip, but again, hip dislocation, you don't want to do anything unless read that article, but those are very hard to replace, so I would be very reluctant, as well as sometimes femur fracture can be very high and close to the hip and you don't know if it's a hip fracture or something. So the pelvis, right over here, you got a lot of vasculature going there, a lot of tissues and vessels and nerve that goes into this area, as well as your urinary tract. So basically you can have difficulty peeing if you cut one of those bones, kind of cut it. Pelvis can be broken in different places. The one that we're really concerned about is this one over here. Well, we're all concerned about them, but this one even more. So you see here, that would be kind of a normal, so it's all attached, and this means that there's a fracture, this is attached, and this is fracture. But you see here, this is fracture, 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 fracture. So a pelvis looks a little bit like a butterfly. So there's two little round circle below and two big ones on the top. And what happened with those ones is called an open book. And the problem with the open book one, so this one right there, is that if you have an open book fracture, if you bleed on your arm, I can stop it with direct pressure. If you bleed from your pelvis, you cannot really apply direct pressure. Very hard to compress something that would be over there. And there's major arteries in the pelvis. And with all those broken bones, there's a lot of chance that you will sever something. So either a artery or a vessels or venous vessels or something, and then you can bleed a lot. You can lose liters, literally liters of blood in there. So because you cannot do pressure, and now that's because it's open book, this thing can kind of inflate as much as it can because there's no limit to it, to the bone. We can do it's very important to do a connection, and I'll show you what to do. Some medical sell a special pelvis binder. But you can improvise a few of them, and this is the most important things that you can do. You can literally save the life of a person. There's a course called the Trauma Life Support for Doctor, and basically they teach you 3 major x-rays. One for the neck, make sure there's no fracture there. One for the chest, because there's a lot of injuries that can happen to the chest. And one for the pelvis, because that's where you can bleed a lot. And those are the 3 major x-rays that you always want to do in a trauma because of this. And so if you suspect any injury to the pelvis, and how are you going to know that? Well, first of all is the mechanism of injury, meaning how did they injure themselves. So for example, if they were on a quad or a bike and they went above their handlebar, and so basically their pelvis hit the handlebar, that's one way they can do. If something fell on them and crushed them, that's another way. So basically, to check the pelvis, the best way is you press and you kind of squeeze it on this side, and you press on each side, and it should kind of be, see, like kind of solid. If it smushes, then that means it's an unstable pelvis. You should put a binder on it, and I'll show you how to do that. So to bind a pelvis, you can use a pad, but the problem with those ones is they're too small. So those ones are just like for sitting pads, just like this. And as you can see, they're a little bit on the small side. But a full pad you could use, and could be very useful. As well, what you can do, use is a jacket, and basically
what you want to do is you want to tie. So the pelvis start where you feel your hip. So you see like where your belt is. And basically what you want to do is bring those two all above and make it as hard as you can, and even actually put maybe something, do kind of almost like a tourniquet kind of thing, and squeeze this part as much as you can. Not too much, obviously, to move bones all over the place, but you really want to squeeze this to create a binder to make sure that the pelvis is connected together.
Okay, so we saw how to deal with a pelvis injury, but also you can have, so the joint of the hip can also not just be dislocated but fracture, and so not so much the joint but maybe part below the joint as well, so the joint will be good, but here at the head of the hip it could be fractured. And how you're going to know that is it's going to be rotated. So basically, if I would look at my legs from like this, a leg would kind of be like this, and as you can see, I'm shortening as well. So rotate it either from the outside, well, it's hard to do from the inside, but either rotate it inside or outside, and as well as we'll be shortening a little bit because the bone is now out. So rotate it and shortening. And those ones, as you can see, the way you could, so you see that gap right here, and basically you would fill that up and try to secure it. So attach the foot to the other leg and use the other leg. If you have those ones are great for spinal boards, but obviously in the outdoors it's rare that you're going to have a spinal boards, and but those would be great for spinal boards. So if you can attach it to the leg and fill out the gap over here with jackets or blue pads or anything that you have to just make it more comfortable, would be the best place to maintain that leg immobilized.